Introduction to cupping therapy. Cupping therapy is an ancient form of alternative medicine where special cups are placed on the skin for a few minutes to create suction. This suction is believed to mobilize blood flow, promote healing, and alleviate various ailments. It is often used for pain relief, inflammation reduction, and relaxation. The practice has evolved over thousands of years across different cultures, adapting to new tools and understandings of the human body. Modern cupping integrates traditional wisdom with contemporary health practices, offering a unique approach to wellness. It is considered a complementary therapy, often used alongside conventional medical treatments. Understanding its fundamental principles is crucial for safe and effective application. The primary goal of cupping therapy is to draw stagnant blood and toxins to the surface, facilitating their removal and promoting fresh blood circulation. This process aims to restore balance and energy flow within the body. Practitioners believe that by creating negative pressure, cupping can release muscle tension, improve lymphatic drainage, and stimulate the body's natural healing responses. It is a non-invasive procedure, though certain types involve minor skin incisions. The therapy is gaining renewed interest in Western societies due to its perceived benefits and holistic approach to health. Proper training is essential to ensure client safety and achieve desired therapeutic outcomes. Historical origins of cupping. Cupping therapy boasts a rich history spanning thousands of years, with evidence of its practice found in ancient civilizations across the globe. Early records suggest its use in ancient Egypt, dating back to 1550 BC, as described in the Ebers Papyrus, one of the oldest medical texts. The ancient Greeks also utilized cupping, with Hippocrates, the father of medicine, advocating for its use in treating various internal diseases and structural problems. These early forms often involved hollowed animal horns or bamboo cups, heated to create suction, demonstrating ingenious adaptation of available materials. The practice was deeply integrated into their medical systems, reflecting a holistic understanding of health and illness. Beyond the Mediterranean, cupping therapy flourished in traditional Chinese medicine, TCM, and Middle Eastern cultures. In China, cupping has been practiced for over 3,000 years, often combined with acupuncture and herbal medicine to balance the body's qi, or life force. Islamic medicine, particularly hijama wet cupping, also embraced the technique, viewing it as a prophetic medicine with spiritual and physical benefits. These diverse historical applications underscore cupping's enduring appeal and perceived efficacy across different medical paradigms. Its global presence highlights a shared human quest for healing through natural and non-invasive methods, evolving with each cultural context. Philosophy and principles. The underlying philosophy of cupping therapy is deeply rooted in the concept of balancing the body's internal energies and promoting natural healing. In traditional Chinese medicine, TCM, cupping is believed to move qi, life force, and blood, clearing stagnation and promoting circulation. Stagnation is often seen as a primary cause of pain and disease, so relieving it is central to the therapeutic process. The suction created by the cups is thought to draw out pathogenic factors, such as wind-cold or dampness, from the body. This holistic approach views the body as an interconnected system, where imbalances in one area can affect overall health. Restoring harmony is the ultimate goal, leading to improved well-being and vitality. Another key principle involves stimulating the body's innate healing mechanisms. By creating localized suction, cupping therapy can trigger a localized inflammatory response, which in turn can increase blood flow, oxygenation, and nutrient delivery to the treated area. This enhanced circulation helps to remove metabolic waste products and toxins, facilitating tissue repair and regeneration. The therapy also aims to release myofascial restrictions, improving flexibility and reducing muscle tension. The visible marks left by cupping are often interpreted as indicators of stagnation being drawn to the surface, signifying the therapeutic action. These principles guide practitioners in selecting appropriate techniques and understanding the body's responses. Types of cupping. Dry versus wet cupping therapy primarily encompasses two main types: dry cupping and wet cupping, each with distinct methodologies and applications. Dry cupping, the more common and less invasive form, involves creating suction on the skin without any prior skin incision. The cups are typically left in place for a specified duration, usually between 5 to 15 minutes, allowing the negative pressure to draw blood to the surface. This technique is widely used for muscle pain, relaxation, and improving local circulation. It is often preferred for its simplicity and lower risk profile, making it a good starting point for many practitioners and clients. The marks left by dry cupping are usually temporary and fade within a few days. Wet cupping, also known as hijama, involves making small, superficial incisions on the skin before applying the cups. After the initial suction, the cups are removed and tiny cuts are made using a sterile surgical blade or lancet. The cups are then reapplied to draw out a small amount of blood, along with interstitial fluid and toxins. This method is believed to offer a more profound detoxification effect and is often used for specific conditions where bloodletting is deemed beneficial. Due to the skin incisions, wet cupping requires stricter adherence to hygiene and sterilization protocols to prevent infection. It is crucial for practitioners to be thoroughly trained in sterile techniques when performing wet cupping. Materials and equipment. Cups. The primary equipment for cupping therapy consists of the cups themselves, which come in various materials, shapes, and sizes. Glass cups are traditional and widely used, especially with fire cupping, as they can be heated to create suction. Their transparency allows practitioners to observe the skin's reaction during treatment. Silicone cups are popular for their flexibility and ease of use, often employed for moving or gliding cupping techniques. They are durable, easy to clean, and do not require an external heat source or pump. Plastic cups, typically used with a manual pump, are also common, offering a safe and controlled way to create suction. These are generally more affordable and suitable for beginners. Other cup materials include bamboo, ceramic, and even animal horns, reflecting the historical and cultural diversity of cupping practices. Bamboo cups are lightweight and traditionally used in Asian cultures, often boiled or soaked in herbal solutions before application. Ceramic cups, while less common today, were historically used for their heat retention properties. The choice of cup material often depends on the specific technique being applied, the practitioner's preference, and the client's comfort. Each material offers unique advantages in terms of heat retention, flexibility, durability, and ease of sterilization, influencing the overall therapeutic experience and outcome. Materials and equipment, pumps and other tools. Beyond the cups themselves, several other tools are essential for effective and safe cupping therapy, particularly for creating and controlling suction. Manual vacuum pumps are commonly used with plastic cups, allowing practitioners to precisely adjust the level of negative pressure. These pumps typically feature a pistol grip handle and a hose that connects to a valve on the cup, providing a controlled and consistent suction. They are especially useful for dry cupping and are a safer alternative to fire cupping for many practitioners. The ability to regulate suction pressure is critical for client comfort and therapeutic efficacy, preventing excessive bruising or discomfort. Proper maintenance of these pumps ensures their longevity and reliable performance. For fire cupping, tools like cotton balls, forceps, and alcohol are necessary to create a flame that rapidly consumes oxygen inside the cup, generating suction. This method requires significant skill and caution to prevent burns. Additionally, sterile lancets or surgical blades are indispensable for wet cupping, hijama, to make the superficial skin incisions. Antiseptic wipes, sterile gloves, and disposal containers for biohazardous waste are also crucial for maintaining hygiene and preventing infection in all cupping procedures, especially wet cupping. A clean, disinfected surface and appropriate draping materials further contribute to a safe and professional treatment environment. These auxiliary tools are as vital as the cups themselves for a comprehensive cupping practice. Mechanisms of action. Negative pressure. The fundamental mechanism of action in cupping therapy revolves around the creation of negative pressure or suction on the skin. When a cup is applied and suction is generated, the skin and superficial muscle layers are drawn upwards into the cup. This negative pressure causes the capillaries beneath the skin to expand and sometimes rupture, leading to the characteristic circular marks, often referred to as cupping marks. Or ecchymosis. This localized trauma, though mild, is believed to initiate a cascade of physiological responses. The intensity of the suction can be adjusted depending on the technique and the desired therapeutic effect, ranging from gentle to strong. Understanding how this negative pressure interacts with the body is key to appreciating cupping's therapeutic benefits. Suction also creates a vacuum effect that pulls stagnant blood, cellular debris, and toxins from deeper tissues towards the surface. This drawing out action is thought to facilitate their removal through the lymphatic system and improved local circulation. Furthermore, the negative pressure can decompress underlying tissues, releasing myofascial adhesions and improving the glide between muscle layers. This can lead to reduced muscle tension, increased range of motion, and pain relief. The mechanical stimulation also triggers nerve endings, potentially modulating pain signals and promoting relaxation. The localized effect of negative pressure is central to both the diagnostic and therapeutic aspects of cupping, providing insights into underlying stagnation and initiating healing processes. Physiological effects. Blood flow. One of the most immediate and significant physiological effects of cupping therapy is its impact on local blood circulation. The negative pressure created by the cups causes vasodilation, meaning the blood vessels in the treated area expand. This expansion leads to a rapid influx of blood to the superficial capillaries and venules. The characteristic redness and circular marks, ecchymosis, observed after cupping are direct evidence of this increased blood flow and, in some cases, minor capillary rupture. This localized hyperemia is believed to be beneficial as it brings fresh oxygen and nutrients to the tissues, promoting cellular repair and regeneration. Enhanced circulation is vital for tissue health and function. The increased blood flow also plays a crucial role in the removal of metabolic waste products and toxins from the affected area. Stagnant blood and cellular debris, which can contribute to pain and inflammation, are drawn to the surface where they can be more efficiently processed and eliminated by the body's lymphatic system. This cleansing effect is a cornerstone of cupping's therapeutic claims. Furthermore, improved circulation can help to break down adhesions and scar tissue, restoring flexibility and mobility to muscles and connective tissues. The localized increase in blood flow is a powerful mechanism through which cupping therapy exerts many of its therapeutic benefits, supporting the body's natural healing processes. Physiological effects. Pain relief. Cupping therapy is widely recognized for its efficacy in alleviating various types of pain, a benefit attributed to several physiological mechanisms. The negative pressure helps to release myofascial tension and adhesions, which are common sources of musculoskeletal pain. By lifting and separating the fascial layers, cupping can decompress underlying nerves and blood vessels, reducing pressure and improving nerve function. This mechanical action can provide immediate relief from tightness and stiffness. Many individuals report a significant reduction in chronic pain conditions, including back pain, neck pain, and headaches, after receiving cupping therapy. The localized trauma also triggers the body's natural analgesic responses, contributing to pain reduction. Furthermore, the increased blood flow and localized inflammatory response induced by cupping can help to flush out inflammatory mediators and promote tissue healing, indirectly reducing pain. The stimulation of sensory nerves by the suction can also activate the gate control theory of pain, where non-painful input closes the gates to painful input, preventing pain sensations from reaching the central nervous system. This neurophysiological effect provides a distraction from pain and can lead to a sustained reduction in discomfort. The relaxation response elicited by cupping, similar to massage, also contributes to pain relief by reducing stress and muscle guarding. All these factors combine to make cupping a potent tool for pain management. Physiological effects. Detoxification. Detoxification is another significant physiological effect attributed to cupping therapy, particularly wet cupping. The suction created by the cups draws out stagnant blood, metabolic waste products, and environmental toxins that may be trapped in superficial tissues. This process is believed to facilitate the body's natural cleansing mechanisms. By bringing these impurities to the surface, cupping helps the lymphatic system and circulatory system to more efficiently process and eliminate them. This can lead to a feeling of lightness and renewed energy, as the body is relieved of its toxic burden. The visible dark marks left by cupping are often interpreted as indicators of the amount of stagnation and toxins drawn out. In wet cupping, the small incisions allow for the direct removal of a small amount of blood, which is believed to contain accumulated toxins and inflammatory substances. This targeted bloodletting is thought to provide a more immediate and profound detoxification effect compared to dry cupping. By removing stagnant blood, the body is prompted to produce fresh, oxygenated blood, further enhancing overall circulation and cellular health. The detoxification process supported by cupping can contribute to improved immune function, reduced inflammation, and enhanced organ performance. It is a complementary approach to support the body's inherent ability to cleanse and rejuvenate itself, promoting long-term wellness. Indications for cupping therapy. Cupping therapy is indicated for a wide range of conditions, primarily those involving pain, inflammation, and stagnation. Musculoskeletal pain is one of the most common indications, including chronic back pain, neck and shoulder tension, sciatica, and fibromyalgia. Athletes often use cupping to aid muscle recovery, reduce soreness, and improve performance. It can also be beneficial for headaches and migraines, particularly tension-type headaches, by relieving muscle tightness in the neck and shoulders. The therapy's ability to improve circulation and reduce inflammation makes it suitable for various inflammatory conditions. Many individuals seek cupping for general relaxation and stress reduction, finding the process deeply calming. Beyond pain, cupping is also used for respiratory conditions like asthma, bronchitis, and common colds, as it can help clear congestion and improve lung function. Digestive issues such as irritable bowel syndrome, IBS, and constipation may also respond to cupping applied to the abdominal area, promoting peristalsis and reducing discomfort. Skin conditions like acne and eczema, believed to be linked to internal imbalances, sometimes see improvement. Furthermore, cupping is often employed to boost the immune system and promote overall well-being by enhancing detoxification and circulation. It is important to note that while cupping can offer relief, it should be considered a complementary therapy and not a standalone cure for serious medical conditions. Contraindications for cupping therapy. While generally safe, cupping therapy has several important contraindications that practitioners must be aware of to ensure client safety. It should not be performed on areas of skin that are broken, inflamed, infected, or have open wounds, as this could exacerbate the condition or introduce infection. Individuals with bleeding disorders, such as hemophilia, or those taking anticoagulant medications, blood thinners, are also contraindicated due to the increased risk of bruising and bleeding. Pregnant women, especially in the first trimester or on the abdomen and lower back, should avoid cupping. Extreme caution is advised for individuals with severe chronic diseases, such as heart failure or kidney failure, as cupping could potentially put additional stress on their systems. Other contraindications include areas with varicose veins, deep vein thrombosis, DVT, or severe edema, where increased pressure could be harmful. Cupping should also be avoided on bony prominences, over major arteries, or on areas with skin sensitivities, allergies, or recent surgical scars. Individuals with pacemakers or other implanted medical devices should consult their doctor before undergoing cupping. It is crucial for practitioners to conduct a thorough client consultation and health history intake to identify any potential contraindications. When in doubt, it is always best to err on the side of caution and advise the client to seek medical clearance before proceeding with cupping therapy. Prioritizing client safety is paramount in all therapeutic applications. Client assessment and consultation. A thorough client assessment and consultation are foundational steps before initiating any cupping therapy session. This process begins with a detailed health history intake covering past and present medical conditions, medications, allergies, and any previous experiences with cupping or other therapies. It is crucial to identify any contraindications, such as bleeding disorders, pregnancy, skin conditions, or recent surgeries, which might make cupping unsafe. The practitioner should inquire about the client's specific concerns, pain levels, and therapeutic goals to tailor the treatment effectively. Active listening and clear communication are paramount to building trust and ensuring a safe and beneficial experience for the client. Beyond the verbal intake, a visual and tactile assessment of the client's skin and musculature in the target area is essential. The practitioner should examine the skin for any lesions, moles, rashes, or areas of extreme sensitivity. Palpation can reveal muscle tension, trigger points, and fascial restrictions that may benefit from cupping. Observing the client's posture and movement patterns can also provide valuable insights into underlying issues. Based on this comprehensive assessment, the practitioner can determine the most appropriate cupping technique, cup size, and duration of application. Explaining the procedure, potential sensations, and expected outcomes to the client helps manage expectations and ensures informed consent, fostering a collaborative therapeutic relationship. Hygiene and sterilization protocols. Maintaining strict hygiene and sterilization protocols is paramount in cupping therapy to prevent cross-contamination and infection, especially in wet cupping. All equipment that comes into contact with the client's skin, particularly if the skin is broken, must be either single-use disposable or thoroughly sterilized between clients. This includes cups, lancets, gloves, and any other instruments. Practitioners must always wash their hands thoroughly before and after each session and wear clean, disposable gloves for all procedures. The treatment area itself must be clean, disinfected, and properly prepared before the client arrives. Adherence to these standards protects both the client and the practitioner from potential health risks. For reusable cups, sterilization methods vary by material. Glass cups can often be sterilized using high-level disinfectants or autoclaving, while silicone cups typically require thorough washing with soap and water followed by disinfection. Plastic cups, if reusable, also need meticulous cleaning and disinfection. Lancets and surgical blades used for wet cupping are always single-use and must be disposed of immediately in a sharps container. All contaminated waste, including blood-soaked materials, must be handled as biohazardous waste and disposed of according to local regulations. Implementing a comprehensive infection control plan is not just a best practice, it is a fundamental ethical and legal responsibility for every cupping therapist. Regular training and updates on hygiene standards are also crucial. Dry cupping techniques. Static dry cupping is the most common and foundational dry cupping technique. It involves applying cups to specific areas of the body and leaving them in place for a set duration, typically between 5 to 15 minutes. The suction is created using either a manual pump for plastic cups, squeezing silicone cups, or using a flame for glass cups. The primary goal is to create localized negative pressure that draws blood to the surface, promoting circulation and releasing muscle tension. This technique is often applied to areas of pain, muscle knots, or acupuncture points. The practitioner carefully monitors the client's comfort and skin reaction throughout the session to ensure safety and efficacy. Point. Before applying the cups, the skin should be clean and free of oils or lotions to ensure a good seal. A thin layer of massage oil or cream can be applied if the cups are intended to be moved later. But for static cupping, a dry surface is generally preferred for maximum suction. The number and size of cups used depend on the treatment area and the client's condition. After the designated time, the cups are gently released by breaking the vacuum seal, usually by lifting one edge of the cup. The characteristic circular marks, ranging from light pink to deep purple, are expected and typically fade within a few days. Explaining this to the client beforehand helps manage expectations and reduces anxiety about the temporary marks. Dry cupping techniques: moving, gliding. Moving or gliding dry cupping is a dynamic technique that combines the benefits of cupping with massage-like movements. Unlike static cupping, where cups remain in one place, gliding cupping involves applying a lubricant, such as massage oil or cream, to the skin before applying the cups. This allows the practitioner to move the cups smoothly across the skin surface while maintaining suction. The movement is typically performed along muscle fibers, meridians, or lymphatic pathways. This technique is particularly effective for releasing widespread muscle tension, improving fascial mobility, and promoting lymphatic drainage. It can cover larger areas of the body compared to static cupping, offering a broader therapeutic effect. To perform gliding cupping, a moderate level of suction is usually applied, enough to lift the skin, but not so strong as to cause excessive discomfort or impede movement. The practitioner uses a steady, controlled motion, ensuring the cup maintains its seal throughout the glide. Common areas for gliding cupping include the back, shoulders, legs, and arms. The duration of a gliding cupping session can vary, but it is often integrated into a longer massage or bodywork treatment. While it still creates redness and temporary marks, these are often less intense and more elongated than those from static cupping. This technique offers a versatile approach to address muscle stiffness and promote overall tissue health. Flash cupping techniques. Flash cupping, also known as rapid cupping or quick cupping, is a technique characterized by applying and immediately removing cups in quick succession. Unlike static cupping, where cups remain in place, flash cupping involves creating suction for only a few seconds before releasing and reapplying the cup to the same or adjacent areas. This rapid application and removal stimulates the skin and superficial tissues without creating strong, lasting suction marks. It is often used to invigorate circulation, stimulate nerve endings, and prepare the skin for other treatments. The technique is particularly gentle and can be beneficial for sensitive individuals or areas where strong suction is not desired. The primary advantage of flash cupping is its ability to create a milder, more superficial effect, making it suitable for delicate areas or for clients who are new to cupping therapy. It can be performed using various types of cups, but silicone or plastic cups with a pump are often preferred for their ease of rapid application and removal. Flash cupping is frequently used as a warm-up technique before static or gliding cupping, or as a standalone treatment for mild stagnation and to promote general vitality. While it may not produce the deep tissue release of other methods, its stimulating effect can be quite effective for improving local energy flow and blood circulation, offering a gentle yet invigorating therapeutic experience. Wet cupping, hijama, overview. Wet cupping, traditionally known as hijama in Islamic medicine, is a more intensive form of cupping therapy that involves controlled bloodletting. It is distinct from dry cupping due to the superficial incisions made on the skin. The process typically begins with dry cupping to draw blood to the surface. After a few minutes, the cups are removed, and tiny, superficial scratches or incisions are made on the skin using a sterile lancet or surgical blade. The cups are then immediately reapplied to draw out a small amount of blood, along with interstitial fluid and toxins. This method is believed to offer a more profound detoxification effect and is often used for specific conditions where bloodletting is considered beneficial. Hijama has been practiced for centuries across various cultures, particularly in the Middle East and Asia, and holds significant religious and cultural importance in some traditions. Proponents believe it helps to remove stagnant or diseased blood, promoting the production of fresh, healthy blood and restoring balance to the body. Due to the skin incisions and potential for blood exposure, wet cupping demands the highest standards of hygiene, sterilization, and practitioner training. Strict adherence to safety protocols is non-negotiable to prevent infection and ensure client well-being. It is crucial for practitioners to be thoroughly knowledgeable in sterile techniques and blood-borne pathogen prevention. Wet cupping. Incision techniques. The incision techniques used in wet cupping are critical for both efficacy and safety. After the initial dry cupping phase, which brings blood to the surface, small, superficial scratches or incisions are made on the skin. These incisions must be shallow, typically only penetrating the epidermis, to minimize pain, bleeding, and scarring. The goal is to create enough openings to allow the stagnant blood and interstitial fluid to be drawn out, without causing significant trauma to deeper tissues. A sterile, single-use lancet or surgical blade is always used for this purpose. The practitioner must ensure the skin is taut and clean before making the incisions, which are usually made in a grid-like pattern or small parallel lines within the cupped area. The depth and number of incisions depend on the client's skin type, the treated area, and the practitioner's experience. It is crucial to avoid cutting too deeply, which could damage nerves or blood vessels and increase the risk of infection or scarring. The incisions should be just deep enough to allow a small amount of blood to be drawn out when the cups are reapplied. After the incisions are made, the cups are immediately reapplied to create suction and draw out the blood. Proper technique minimizes discomfort and ensures a controlled, therapeutic blood extraction. Following the procedure, the area must be thoroughly cleaned and dressed to prevent infection. Mastery of these incision techniques is a hallmark of a skilled and responsible wet cupping practitioner. Wet cupping. Post-procedure care. Post-procedure care is crucial after wet cupping to prevent infection, promote healing, and ensure client comfort. Immediately after the cups are removed, the treated area must be thoroughly cleaned with an antiseptic solution to remove any remaining blood and disinfect the skin. Sterile gauze or cotton pads are used for this purpose. It is essential to ensure all incisions are clean and free from debris. The practitioner should then apply a sterile dressing or bandage to protect the incised skin from environmental contaminants and allow it to heal properly. This dressing should be breathable but provide adequate coverage. Proper wound care minimizes the risk of infection, which is the primary concern after any procedure involving skin breaks. Clients should be given clear instructions on how to care for the treated area at home. This typically includes keeping the dressing clean and dry, changing it as recommended, and avoiding showering or bathing for at least 24 hours. They should also be advised to avoid strenuous activity, direct sunlight, and swimming pools for a few days to prevent irritation or infection. The practitioner should explain what to expect during the healing process, such as mild soreness or itching, and instruct the client on signs of infection to watch for, such as excessive redness, swelling, pus, or fever. Providing comprehensive aftercare instructions empowers clients to take an active role in their recovery and ensures optimal healing outcomes, reinforcing the practitioner's commitment to client well-being. Safety guidelines and best practices. Adhering to strict safety guidelines and best practices is paramount in all cupping therapy applications. This begins with a thorough understanding of contraindications and a comprehensive client health assessment. Practitioners must always prioritize client safety by ensuring all equipment is sterile or single-use, and that the treatment environment is clean and hygienic. Proper hand hygiene, including washing and gloving, is non-negotiable. For fire cupping, extreme caution must be exercised to prevent burns, and for wet cupping, meticulous, sterile technique is essential to prevent infection. Never reuse lancets or surgical blades, and always dispose of sharps and biohazardous waste correctly. These measures protect both the client and the practitioner. Beyond physical safety, ethical considerations and professional conduct are also best practices. Practitioners should obtain informed consent from clients, clearly explaining the procedure, potential risks, benefits, and expected outcomes. Maintaining client privacy and confidentiality is crucial. Continuous education and staying updated on the latest research and safety standards are vital for professional development. Practicing within one's scope of practice and referring clients to other healthcare professionals when necessary demonstrates responsible care. By integrating these safety guidelines and best practices, practitioners can ensure a high standard of care, build client trust, and uphold the integrity of cupping therapy. Potential side effects and management. While generally safe, cupping therapy can result in several potential side effects, most of which are mild and temporary. The most common side effect is the characteristic circular marks, or ecchymosis, which range in color from light pink to deep purple. These marks are a normal physiological response to the suction and typically fade within a few days to a week. Circular marks, or ecchymosis, which range in color from light pink to deep purple. These marks are a normal physiological response to the suction and typically fade within a few days to a week. Other common side effects include mild soreness or tenderness in the treated area, similar to post-massage muscle soreness. Some clients may experience slight dizziness or lightheadedness, especially during their first session or if they are prone to vasovagal responses. It is important to reassure clients that these effects are usually transient and part of the healing process. Less common but more serious side effects can include blistering, burns, especially with fire cupping if not performed correctly, or infection, particularly with wet cupping if sterile protocols are not followed. Practitioners must be vigilant in monitoring clients during and after the session for any adverse reactions. Management of side effects involves proper aftercare, such as keeping the area clean and protected, and advising clients on how to manage soreness, e.g. warm compresses. For more severe reactions, like blisters or signs of infection, immediate medical attention is necessary. Educating clients about potential side effects and how to manage them, along with clear instructions on when to seek medical advice, is a critical aspect of responsible cupping practice. Prevention through proper technique and hygiene is always the best management strategy. Aftercare advice for clients. Providing comprehensive aftercare advice to clients is essential for optimizing the benefits of cupping therapy and minimizing potential side effects. Clients should be advised to keep the treated areas warm and covered for at least 24 hours to prevent exposure to cold or drafts, which could exacerbate muscle tension or discomfort. Avoiding strenuous exercise, heavy lifting, and intense physical activity for 24 to 48 hours is recommended to allow the body to rest and heal. Hydration is crucial. Clients should drink plenty of water to help flush out toxins and support the body's natural detoxification processes. This simple advice can significantly enhance recovery and the therapeutic outcome. Clients should also be instructed to avoid showering, bathing, or swimming in fluorinated water for at least 24 hours, especially after wet cupping, to prevent infection and allow the skin to heal. For dry cupping marks, applying a soothing balm or natural oil can help reduce tenderness and accelerate fading. Clients should be advised not to pick at or scratch any marks or scabs that may form. Clear instructions on when to seek medical attention for unusual symptoms, such as excessive pain, swelling, pus, or fever, are vital. Empowering clients with this knowledge ensures they can actively participate in their healing process and feel confident in managing their post-treatment care, fostering a positive therapeutic experience. Integration with other therapies. Cupping therapy can be effectively integrated with various other complementary and conventional therapies to enhance overall treatment outcomes. It often pairs well with massage therapy, where cupping can be used before or after massage to deepen muscle release, improve circulation, and prepare tissues for manual manipulation. The combination can lead to more profound relaxation and pain relief. Similarly, cupping can complement acupuncture by stimulating specific acupoints and meridians, amplifying the energetic balancing effects. Many traditional Chinese medicine practitioners routinely combine these two modalities to address complex conditions more comprehensively. This integrated approach leverages the strengths of different therapies for synergistic benefits. Beyond manual therapies, cupping can also be integrated with chiropractic care to support spinal alignment and reduce muscle guarding around the spine. In physical therapy, it can aid in rehabilitation by improving range of motion and reducing fascial restrictions. Herbal medicine and nutritional counseling can further support the body's healing and detoxification processes initiated by cupping. When integrating cupping with conventional medical treatments, it is crucial for practitioners to communicate with other healthcare providers and ensure a coordinated approach to client care. This collaborative model ensures safety and maximizes therapeutic efficacy, offering clients a holistic and well-rounded path to wellness. Legal and ethical considerations. Practicing cupping therapy involves significant legal and ethical considerations that practitioners must uphold to ensure professional conduct and client protection. Legally, practitioners must be properly trained, certified, and licensed according to the regulations of their specific region or country. The scope of practice for cupping therapy varies widely, and it is crucial to understand and adhere to these boundaries. Operating outside one's legal scope can lead to severe penalties, including fines, license revocation, and legal action. Maintaining accurate client records, including health history, treatment plans, and informed consent forms, is also a legal requirement and a best practice for accountability. Compliance with health and safety regulations, particularly regarding hygiene and waste disposal, is non-negotiable. Ethically, practitioners have a responsibility to prioritize the client's well-being, provide honest and transparent information, and maintain strict confidentiality. Obtaining informed consent, where clients fully understand the procedure, its risks, benefits, and alternatives, is a fundamental ethical principle. Practitioners must avoid making exaggerated claims about cupping's efficacy and ensure their marketing is truthful. Respecting client autonomy, cultural beliefs, and personal boundaries is also paramount. In cases where cupping is not appropriate or a client's condition requires medical attention beyond the scope of cupping, ethical practice dictates referring them to a qualified medical professional. Adhering to these legal and ethical frameworks builds trust, protects clients, and upholds the integrity of the cupping therapy profession. Conclusion and future of cupping. Cupping therapy, with its rich historical legacy and diverse applications, continues to be a valuable complementary modality in modern wellness. From its ancient origins in Egypt and China to its contemporary resurgence, cupping has demonstrated enduring appeal for its ability to address pain, inflammation, and stagnation. The fundamental principles of negative pressure, improved blood flow, and detoxification underpin its therapeutic effects, offering a holistic approach to health. As research continues to explore its mechanisms and efficacy, cupping is increasingly recognized for its potential benefits in various health conditions. The journey through its types, techniques, safety protocols, and ethical considerations underscores the depth of knowledge required for responsible practice. The future of cupping therapy appears promising, with growing interest from both practitioners and the public. As more scientific studies emerge, integrating traditional wisdom with evidence-based practice will be key to its continued acceptance and evolution. Innovations in cup materials and application methods may further enhance its versatility and safety. Education and standardized training programs will play a crucial role in ensuring high-quality practice and protecting clients. Cupping therapy is poised to remain a significant component of integrative medicine, offering a unique and effective tool for promoting well-being and addressing a wide spectrum of health concerns in a holistic manner. Its continued evolution will be shaped by ongoing research, professional development, and a commitment to client-centered care.